And I would like to thank all the mental health ministry volunteers for putting all the work that you put in. It's been a lot, and preparing these sessions, and just working to get this started in our parish. So thank you very much. They're not professionals, although some of them, have worked in the health area, and so although Kate, you studied, you have a, or not, you did in college.
Yeah, I was a counselor for a few years.
Exactly.
Yeah.
So they do have some experience in that area, but they're not licensed professionals. That's the first thing that we wanted to just clarify, if there's any confusion with regards to that. But we are here to provide resources and try to point people in the right direction if they need any help. And why do this? Well, our Lord Jesus Christ preached the message of the gospel, and he cured the sick. And so he wants us to do the same. He wants us to practice charity in whatever way we can, and also bringing health and healing to those who may suffer from mental illness, or also the people, family and friends that may have relatives or friends or acquaintances that suffer from that illness. So we're here to provide the resources and also support groups that can help the people who either struggle with mental illness or the people that care for them. We know that it's sometimes very difficult. It can be very scary, and so I think that we need to help people in any way we can. As you know, we've gone through a long pandemic, and as a priest, as a pastor, I've seen the effects in mental health on a lot of people. A lot of people that apparently they were healthy, or but just the anxiety, the stress, the isolation sometimes, and other effects caused by the pandemic, and the circumstances regarding around the pandemic have affected a lot of people in different ways and completely unexpected. And so I know how difficult it can be for those going through mental illness, and those who care for them. So when I was approached, I think it was Kay who first approached me with her interest in starting something like that in my parish. I said, yeah, go ahead, and you have my blessing, my support, and that's what she did. So I thank them again, and I thank all of you for coming, and I hope that this will be helpful and fruitful in your lives. All right, your turn.
Thank you, Father. All right, tonight's speaker, as you may recall from reading the bulletin, is going to be a 5-night series. So come to one, come to all. There's different topics every week, so it's always going to be ever-changing as far as the content. Tonight's speaker is Deborah Johnson, LPN of the Recovery Coach and Director of Sauk Prairie Care Recovery Program. Debbie has a 38-year history of experience in the medical field. She retired and started volunteering at the local free clinic and was hired by St. Vincent de Paul as the clinic coordinator, recovery coach of the CARE program in 2014. In collaboration with and support of St. Vincent de Paul of Sauk Prairie, Joan Mack, RN, and Ted Hall, the pharmacist and medical provider, Ho-Chunk Nation, and the concept of care recovery model was developed. Sauk Prairie Care Recovery Program connects individuals with substance use disorder to the resources necessary for all quality of life. Debbie assists individuals in identifying recovery barriers and provides guidance to overcome those obstacles. Debbie started the weekly Sauk Prairie Al-Anon family group meeting, knowing addiction is a family disease. St. Vincent Resource Center hosts all 12-step meetings every night of the week, either in person or virtual. Over 700 individuals attend meetings in a month at our center. The CARE program has seen over 500 individuals with substance use disorder since 2014. In collaboration of the Good Neighbor Clinic, our local free clinic, we were able to provide, is it Alkermes injections of Vivitrol to our clients. Vivitrol is a once-a-month injection prescribed to treat opiates and alcoholic addiction. St. Vincent's also provides counseling service to uninsured people. Counseling is vital to teach coping skills, identify cravings and triggers. St. Vincent's Resource Center hosts AA, NA, and Al-Anon meetings. Debbie is native to Wisconsin. She has 3 adult children, 5 grandchildren, and married to her husband, Carrie, for 38 years. She enjoys traveling, boating, and hiking the beautiful local parks with her family. Please join me in welcoming Debbie.
So I hope I don't repeat some of what was just said in that great introduction. So the history of the CARE program, yeah, it was based on a couple women, Joan mainly, and I came in a few months later, that we had a lot of personal pain in our family with loved ones with addiction. She had a granddaughter who was in jail at the time with a heroin overdose, and I had a son who was at the UW and was struggling with his own addiction. Out of the pain of seeing our loved ones and trying to get resources, we soon found out there wasn't a lot of resources around. So Joan said, well, I'm going to be starting a program for the uninsured and the people that just are not able to get the care in our area. And I was like, I just newly retired, and I scrapbooked for 2 weeks. I'm like, I'm done with that. I am so bored. I don't know what to do with myself. So I said, I can help you. And the CARE program started, and we sent out a bunch of notices in our community and thought maybe 5 people would show up to this first meeting. We had 30 people show up because there was just so much need, and the police departments, they were getting bombarded with overdoses in the bathrooms and the gas stations and the restaurants, and there were students in the schools getting expelled with supplies of or paraphernalia of drugs. And we brought everyone together in our community, Sauk County, the police department, EMS, the medical providers, clergy, and we sat around a table and like, we got a problem, and what are we gonna do about this? And it was through the collaboration of all of those people sitting around that table that we created the CARE program. Dr. Ted Hall, who is a provider, but a pharmacist at the Ho-Chunk Nation, he had been giving Vivitrol and had an addiction medicine program for years. And when we said, we wanted to start something like that, he handed over his program and said, then start it. So it was, the generosity and the collaboration of everyone that was around in St. Vincent's for supporting a mission that was gonna cost them a lot of money to do. And that's kind of how we got started. We started with individuals that were in Sauk and Prairie in jail. Because we were seeing people coming out of jail and they were overdosing. And what was happening was they were coming out and using the same amount of opiates as they did when they went in. And their tolerance was not that high, so they were overdosing and a lot of them were dying. So we thought if we could get an injection of Vivitrol, which blocked the opiate and a lot of the alcohol receptors before they left jail, and then set up resources for them, you know, that would be an awesome thing. But everybody thought it was a great idea, but who's gonna pay for it? At the time, it was like $800 to $900 an injection, and the injections had to be given every month. Those injections now are near $2,000. So we started with that, and then we ended up, we had deals with a couple of the behavioral health clinics in town. They would give us a deal on counseling because we knew just giving a shot of Vivitrol was not the golden ticket to sobriety. They needed counseling. Many of them had suffered a lot of trauma or some life-changing event. And also, we are big 12-step thumpers. We believe in it. It's helped me when our son got sent to detox in another state. I was handed a 12-step, 12 tradition book, and they said, and you go to Al-Anon. And I was like, what did I do? Like, if you could just fix him, I would be fine. Not realizing that it was a family disease. It affected all of us. And I didn't realize that my enabling, which I just thought I was helping, was really hurting him. And that he knew how to play me. It was like they told me, stop doing the dance. And I didn't understand anything that they were talking about. I went into these meetings, I sat down, and to me it felt like kind of a cult. It was like, they're all saying the same thing, they're reading all this stuff, I don't understand it. But the one thing that I felt was the comfort that these people have walked in my shoes. They understand me, and they understand the pain that I'm going through. And they were not judging me, and they were supporting me in my journey as a mom of someone with addiction. Since that time, we have hired a counselor, a master level counselor, and that's been working out really great. We know that we have counseling clinics in our community, but when I call those counseling clinics, even if my client is suicidal, it is a 6-month wait. It is really heartbreaking that people, especially when they are willing to get the help, cannot get the help because we just don't have the resources for it. And we go right back to our 12-step program because, we're not professionals, but we listen and we care. And a lot of times, people don't really care about what you know until they know you care. And there's a lot of power in the, you know what, me too. And every Wednesday night, you'll find me at the Resource Center, sitting around a table amongst a lot of wonderful people that they have gone through the same kind of things that I have gone through with a child with addiction. And I think God speaks very loud. Our higher power speaks really loud in those programs. It's been very comforting, and knowing that we can't fix them, but rescued people rescue people. And the saying is, hurt people people hurt people, and that's why, you know, it's so important to have some sort of fellowship or something like what you're doing here tonight, you know, bringing people together, just increasing the awareness that, yeah, we do have a problem here, and in every community, it's not just here. And with the whole Be Kind movement, you know, putting that into action. And I'm hoping that the schools will talk about that, and I'm sure they are. You know, if it's seeing a child that, you know, is getting picked on, you know, being able to step in and support that person. You know, it's a lot easier for some of these kids because there's so much peer pressure just to go along with the crowd. But, you know, I think we just need to make a movement of sometimes it's better to sit next to the person that is suffering and how much gratification you're going to get out of saving a life, potentially. With the CARE program, and Joan has retired, and I've now got an assistant, because I'm going to be semi-retiring the end of the year. I'm going to try the snowbird thing. I'm not sure how that's going to go, but I know I'm going to miss it, but I'll be back in April. We continue to give Vivitrol injections at the Good Neighbor Clinic. We've collaborated with them, and you know, without them, we would never be able to do that. They do have a psychiatrist, and they have a couple providers that are not trained psychotherapists, but are awfully good at listening, and one in particular that works at Sauk County in mental health. Let me look at my notes, since I haven't said anything that's on this paper here. I want to talk about some of the resources that if you do have someone that is suffering with addiction, Wisconsin has this number now, it's 211. And if you just dial 211, you can be connected to an array of different resources like housing, utilities, and mental health and addiction. The other number that just came out, the suicide hotline, is 988. And people will get connected to someone who is trained to take those crisis calls. I also am the chairperson for Partnership for Prevention of Sauk County, and we established that coalition in 2017, and that's a community-based coalition, and the purpose is to prevent and reduce substance use in our youth. And I have some folders out, and there's a lot of statistics in there. I knew I would not have time to go over a lot of what I thought was really beneficial for you to know. I'm just gonna highlight on a few of them. In 2019, the Sauk County High School students, the past 30-day use of alcohol was 43% of all students. And in Wisconsin, that is 30%. For binge drinking, and that's more than 5 drinks at a time, or at a setting. That was, in Sauk County, was 16%, and in Wisconsin was 13%. 19% of Sauk County middle school students reported past 30-day use of alcohol. That's 7th and 8th grade. And then the rates of the youth tobacco use are very high too, 26%. The students report vaping in 2019, about 30%. Wisconsin as a whole was 21%. And then another alarming 14% of Sauk County middle school students report vaping in 2019. And according to the key informant interviews, they say that that is very underrated or underreported, that they feel it's much more than that. Because 44% of youth violations are alcohol related, and over half of the school suspensions are related to tobacco or alcohol. Roughly 85% of the Sauk County Child Protective Services cases involve substance use disorder in the home, and 60% of the 2017 juvenile court cases involved alcohol and tobacco. On the flip side, the positive side was we only had a 2% dropout rate, so they must like going to school. Sauk was the worst for 5th of Wisconsin counties for opioid overdose deaths and hospital encounters since 2012. The history of overprescribing narcotics it's improved, but it's still a lot. As I mentioned, the prevention efforts, what I do is, with the Al-Anon meeting and promoting all 12-step meetings, also participate in the Take Back program. The Take Back program started in 2010, and that is to get like all unused prescriptions out of houses and off the streets. Because most kids, or I call them kids, they're 20, 30, 40 years old, but when I talk to them about substance use and opiate addiction, and I ask them where they got the substance, it's from family or friends. Our last collection was April 30th, and we were just under 60,000 pounds of prescription drugs that we collected, and we were the highest in the nation. The next Take Back is October 29th, and you don't have to wait until that day. We have areas in our community, one being the police station here, that has a drop box that you can collect the pills, you can just drop it, nobody's gonna talk to you, no questions asked, you just go drop the medications in. We have Narcan training, we have fentanyl test strips through the county. The other thing I just wanted to touch on was the stigma. And stigma is a big barrier with mental health and addiction. Often delaying treatment, and due to the shame of having this. It just makes you feel different. Especially in such a alcohol, I don't wanna say absorbed community or state. It's like, I talk to a lot of the clients I work with and say, have you ever been to a campfire without alcohol? No. Have you ever been to a birthday party without alcohol? No. How about a baptism? No. It's like everything is revolved around what do you bring and what do you want to drink. We're working on changing the verbiage of addiction, such as like alcoholic. It's like ick. It's like ick. It's just, who wants to be called an alcoholic? Who wants to be called an addict? I mean, we don't say, if you have, say, cancer, we don't identify you as, oh, the cancer. So I'm just pleading with people just to think about that when you are around people that have addiction. Because, their disease, it's a chronic brain disease, and it doesn't define them. Most people with addiction, they have some sort of mental illness, anxiety, depression. When you read through all the statistics that I put in your folders, it's like 40% of the students in school state that they've had anxiety. I mean, the numbers are really high, especially after the pandemic. That's really caused those numbers to increase. I just wanted to open up, if anyone wants to be part of the coalition for any leadership opportunity up at Sauk County on the Partnership for Prevention, I have a sign up. If you just wanted some more information on it, I'll just put it out here and I can pick it up next week. If anyone, wants to know more about Partnership for Prevention for youth prevention efforts, you can just put your name on here and then we will get a hold of you. Our meetings are only once a month, it's the fourth Thursday, and it's an hour, like 1 to 2. And from 12 to 1, there's another Wisconsin Alliance for Youth that we meet, and we can go over modules for prevention education efforts. I will put that out here. I think my time is about done. I'm going to, I have the honor of introducing Derek. Derek is an individual that I have worked with for probably about a year. He's been in the CARE program, and he wanted to tell a story about, what if you provide resources to someone, like what a difference it does make. So, without further rambling, I will have Derek come up here.
Good evening.
Is he comfortable recording?
Sure, I'm fine.
Okay.
Just don't put it on YouTube though.
No.
Unless you get a lot of likes, and I want some of them.
Yeah.
All right, good evening. Thanks for having me. My name's Derek. I'm 34 years old. Been diagnosed with multiple mental illnesses, and I'm an alcoholic. A year ago, I probably wouldn't have thought I'd be doing something like this. But here I am. My first memory growing up was my parents fighting. I remember my dad forcing my mom out of the house. She came home late, and he didn't know why. So, he didn't let her in the house. That was one of my first memories, and I'll never forget it. A few years later, they ended up getting a divorce. I lived in 3 different houses with my mom and my sister before eventually we found an apartment. Since the divorce, I've had 5 different step-parents, 3 with my mom and 2 with my dad. In total, I've had 8 step-brothers and sisters. When I turned 9, 3 of my cousins, which were sisters, their mother died in a fire. They moved in with us too. So by the time I was 9 years old, I had 7+ people living in a 4-bedroom house. I remember when I was in 3rd grade, I had a teacher.
whenever I wasn't paying attention, she would grab my chin, look me in the eye and say, Derek, pay attention. It was addressed, but nothing was done with it. When I was 9 or 11, I started to become very shy. My self-esteem went down. It wasn't addressed, we just didn't think nothing of it. When I was 12 years old, I remember I would degrade myself openly. I'd make fun of myself just to grab people's attention. You know, I was often shy and I really couldn't communicate with people. So I did whatever I could to get a laugh. You know, if people laugh, you know, that's a positive. People like me. When I was 14 years old, I was almost charged with sexual assault. I was experimenting with a friend who was 3 years younger than me. Instead of getting charged, I had to go to the Sauk County Courthouse, visit a social worker for a month and a counselor. That was the first time I ever had counseling, believe it or not. When I was a freshman in high school, I got sick from pneumonia. Was out for school for almost a month, including a week in a hospital. And around that time, I started having body issues. You know, I was skinny, I had glasses, you know, I was easily picked on. When I was 17 years old, my grandpa, he was actually my step-grandpa, but he was considered my grandpa because I knew him all my life. He died from brain cancer out of nowhere after a 10-year remission. I was lost. I couldn't handle it. By the time I turned 18, though, you know, that's really when I started drinking. Everything, you know, took extreme, you know. I had friends, but they were more like bullies. You know, they would hit me, they would talk trash to me. They weren't really friends, but, you know, I was shy and I hated myself anyway, so what was I going to do? My current stepmom, she accused my sister of stealing, and that was very hard on me. After I graduated high school, I wanted to actually open up restaurants. I went to MATC to get my associates in business management, and that was a plus for me. I'm like, you know what, I'm gonna do something with my life. Around that time, my mom married our husband. Let's just call him Vic. He was more of a bully to me than a father. He would belittle me, he would pick on me, he'd get in my face, yell at me, scream at me, you know, if I did something wrong, or if he disagreed with me. And around this time, I also worked at a bowling alley. This allowed me to drink behind the bar, and I often did this with my coworkers. And around this time as well, I went and saw a counselor for anxiety and depression. And unfortunately, that didn't work. Around 20 years old, I ended up getting myocarditis, which is an infection in my heart, which I went to UW, but no one knew where it came from. I was on a low-fat, low-cholesterol, low-sodium diet for a month, and it took me years to recover. Also, when I was 21, I decided to go to UW Stevens Point. I was actually majoring in soil and land management. I wanted to do something outside. But around this time, my drinking never really slowed down. You know, when I was a freshman, I was 21 years old. So I was the guy that was buying alcohol for everybody, you know. This is my way of people accepting me. Let's go party, let's go have fun. I started seeing a psychologist around this time as well. There I was diagnosed with attention deficit disorder. It amazes me that I wasn't diagnosed with it earlier, but my parents never knew. I've always been antsy. I mean, I bet you Nate over there, you probably notices me whenever I sit down, I'm always just shaking, you know, I can't stop. I also began antidepressants around this time as well. around 22, 24 years old, I fell in love for the first time. This is something I never thought I would accomplish. You know, I felt so little of myself. You know, I thought this was never going to happen. I went to Europe for school. I did a 1-month trip to Europe for to learn about how 3 different countries, Germany, Poland, and Iceland, manage their natural resources. And instead of learning, I spent the whole time drinking. I was drunk. I barely passed, but I spent most of the time drinking. And around this time, I started drinking to become the person that I wanted to be. You know, when I was sober, I was a very shy introvert. And when I was drunk, I was excited. I was ready to have fun. I didn't care what I said. You know, I didn't care if I, you know, did property damage or what have you. It let me escape. But really, what allowed me to be was a monster. I've done things while I was drunk and I'm ashamed of. I've ruined relationships. I've destroyed property. When my girlfriend broke up with me, I went home and got trashed, and I went to 3 or 4 bars, and I went and destroyed their toilets. Why? Because I was mad and I was drunk and I didn't care. Well, I graduated UW Stevens Point, and I couldn't find a job because I didn't have the experience. So I got a job that was supposed to be part-time, but I've been there for 7 years. And that right there has been a huge blow to my esteem. I spent all this time working, and I couldn't find a job. And I thought little of myself. Fast forward to the last year or so, I started isolating more. I didn't talk to my friends. They very rarely, talked to me. I pretty much stayed to myself. But I realized that, hey, I might have a little drinking problem. Well, Labor Day last year, I went golfing with my sister's boyfriend at the time. And I was only going to limit myself to 2 drinks. You ask an alcoholic, that cannot be done. I was one of those people that when I start drinking, I could not stop whatsoever. We ended up just getting plastered. I mean, absolutely drunk. We got home and we got into it. It got to the point where I told my sister's boyfriend to get his stuff and get the heck out. I couldn't take it anymore. So I went to my room, grabbed a notebook, took all my prescription pills, a nice bottle of Excedrin extra strength, and I was going to write my suicide note, pour myself a glass of water, and I was going to end it. I didn't. I feel it was my higher power. I think it was God telling me to don't do it. My sister went to check up on me, and I was putting my shoes on, and she's like, "What you doing, Derek?" And I said, "I'm going to the hospital." She said, "Why?" And I pointed, and I said, "Look." And there, right there, was the notebook, the glass of water, and the pills. So we went to the emergency room. My blood alcohol content was 0.216. Just for the heck of it last night, while I was writing this, I Googled. And 20.20 .30 was very dangerous. The nursing staff there decided that the best course for me was to sober up, and what they did is that they contacted the Sauk County Crisis Line. So when I was sobered up, I was talking with them, and the best thing that they had me do was go to an inpatient mental hospital. So there I went to Miramont Behavior Health in Middleton, Wisconsin, volunteering. And I was thinking, I'm just gonna be there for a few days. I ended up spending a week. And I paid as much attention as I could. I wanted to learn as much as I could. There, I was diagnosed with major depression disorder. When I got discharged, they set me up with some outpatient treatment. There, I started this intensive outpatient program. It's MRT, which is mental recognition training, and what it is supposed to help people avoid recidivism. It's a behavior change. It's a 12-week program, and I ended up doing it twice. But I remember my intake. The lady running it, she was interviewing me, and she said, "Hey, Derek, you're an alcoholic." I said, "No, I'm not." To me, an alcoholic was someone who would drink every day. I wasn't one of those people that drank every day. I was a binge alcoholic. But if I really think about it, I couldn't stop when I wanted to drink. I look forward to drinking all the family reunions, family events, Christmases, anything. Even out golfing, I was always drinking, and I look forward to that. And that's when I came to terms with it. Hey, I do have a problem. So I did the treatment. I also started going to AA meetings. And they hooked me up with Deb, and I credit her with helping me save my life too. I got the shot, Vivitrol shot, and that has helped me to this day. And I look forward to it every month. This past February, I did a recovery coaching online through the Connecticut Community for Addiction Recovery. There, I got my certificate as a recovery coach. This past May, I did my training to be a certified peer support specialist. And then at the end of the month, I take a test, and then once I complete that, I'll be certified. That's what I want to do. I want to help fellow alcoholics or addicts or people with mental health. I've been in their shoes. I know what it's like. As of today, I'm 371 days sober. I'm loving life. And I don't want to be the problem anymore. I want to be part of the solution. The 12th step for AA is to pass it forward. And if you're not doing that, then what's the point? So whenever someone is in need, I'm there. I'm always a phone call away. Thank you for your time.
Thank you. Anybody else?
You want me to go?
Yeah,
Well, that's kind of tough one to follow there. I suppose.
How many minutes does he have?
You don't mind, do you?
No.
I'll try to keep it short. I'm a rambler. My name's Nathan Steve. I'm an alcoholic and an addict. I was going to say mine is Derek's stories are a little similar, but they couldn't be further from apart, I suppose, in a sense. At 13, I had my first drinks. I was buzzed and it felt great. I didn't have self-esteem issues. I was pretty well liked. I had a lot of friends who did sports, was outgoing. But by 14, my freshman year, I had my first blackout drunk. and I had dozens more within my high school career. I wrestled, I played sports, I smoked a shit ton of weed, but I would drink. And we would steal beer, and we would drink. I would lie to drink. I'd pretend I was study groups to drink. Really, it was whatever parties it was. I didn't know, I had we had alcoholism in my family. And to the point of the stigma of it, like Derek said, it was somebody that drank every day, was belligerent, couldn't handle their own things, just a sloppy mess. That was, that was what we all grew up on, is what an alcoholic was. I wasn't that in my head, but looking back, I lied a lot to drink and to use drugs. I would miss family events because I wanted to drink. I would make up excuses not to go to these events to use. I'd come up with anything. Derek liked to go to his family events. I did not, because my family was there and they knew I had a problem, but I couldn't see that, so I couldn't drink the way I wanted to, or I couldn't be high. I graduated high school. I went to tech school. Everything was good, going great there. And I found powdered and crack cocaine in Nashville, Tennessee. The taste and the feel and the smell and the feeling of what crack cocaine did that first hit will never leave my body. When people speak of it, I get excited, and it scares me. Still to this day, it's been over 20 some odd years. And my heart races, I get sweaty. I feel like I gotta use the bathroom, because that's when I was getting it, that was the rush, that was the feeling. And I managed to survive through that for almost 6 months, calling my mother every day, begging for more money. Listening to her cry on the phone, wondering why she was sending it to me, wondering why she couldn't come down to see me, wondering why I wouldn't come home. And all I could say was just send more. I remember, I think there was a 7-day period in a row I did that every day. And she would send it. And I'd do the same thing. But by the time I got it out of the machine, it was already gone. It was already spent. I was 190 pounds when I left high school, and I came home, I was 135. I was pure white. I had, if I had an appetite, I'd just smoke some cocaine, and I'd be gone. I was there for 2 weeks, and I gained probably 35 pounds. But nobody once ever asked me what I was doing. Nobody once asked why I looked like that. But I'm pretty sure it was fairly obvious. Somebody went, I lifted weights, I was big, came back 55 pounds less within months. I managed to get through that period of my life, which was robberies. Committed several of those to keep that habit going. I had friends from this area down there, and I screwed them over big. I'd sell their information for their cars and whatnot, so people would steal their cars, and they'd pay me cash for them. I'd rob my roommates to keep that going. And I guess you could say karma. On my last day, they robbed me. And all I could do is my dad got pissed, and I said, we just get in the car and we go. They left my suitcase with all my clothes. They took everything else. I said I just wanted to go. I did pretty well when I got back. I was probably 18, 21 by that time, but by that time I was at the bars every Friday. Payday was Friday, so I go to the tavern. And 1 or 2 was never it. It was till I was belligerently drunk. You'd walk 1 step forward only to fall 6 places back. By the time I was 22, I had my first DUI. By the time I was 25, I had my second. By the time I was 30, I had my third. By the time I was 33, I had my fourth. Within that time, I also found powdered cocaine. I lived in Madison. I sold it. I dealt it. I used it as currency. I would look in the mirror. I couldn't take hot showers for the longest time because anything that if the warm water hit my face, my nose would just start bleeding out. I had no sense of taste, no sense of smell. I had no appetite again. I lived with a woman. I really surprised that she ever didn't kick me out. I'd mow her lawn, and I'd get so hammered that I'd pass out in the yard, and the lawnmower would still be running. And I did that on a nightly basis. The bar was just down the block, so that's where I'd go. I'd use there. I mean, that's like 6 more years of my life I dedicated to drinking and using drugs. And my reasoning was I could do it because I had a job. I could still get up and go do what I had to do. I still committed, I still had whatever plans I had, I could still commit to them. So I didn't have a problem, you know. I could still do what had to be done in my mind, what it was that I had to do. As soon as work was done, bam, right to the bar. We got done at midnight. We were there at 12:05. Drunk, and sit there till 3 a.m. and drink as much as I possibly could. Got to a point where 12:05 come, they'd have 6 shots lined up with 3 drinks. By 12:15, I'd have all that gone. And I'd just rinse and repeat. Eventually, it got so bad that I was in a relationship too with a girl I loved, and it went south. And I didn't know how to cope. As any alcoholic would ever, I didn't know how to deal with my own feelings. I didn't. The only thing I could think of was to drink or use. So I got drunk, like 7 a.m. drunk. And I got some powder and I used that. So I was even worse off by and it was by the time 7 p.m. rolled around, I had 15 to 16 cops from Dane County, DeForest, Wanakee, 2 Walmart security guards, all standing around me. Because I fell in the main highway and hit my face on the curb and I was bleeding to death. But I was blackout drunk. I barely remember any of this. But I remember that part. I remember coming to, and there was a lot of them, and I was fighting every one of them. I remember waking up in the hospital, and then I remember refusing to have anything done to me. So I woke up the next few hours later in a detox, in a room made of concrete, on a slab made of concrete with no blankets, no pillows, no windows, just you and a door that you couldn't open. It wasn't jail, it was a detox. And I sat there for 13 hours because I had to blow under the legal limit. I finally did it, and I had the woman I was living with came and got me. Not a word was said. Nothing. We just went home, and I looked. She didn't say a word to me. And I went downstairs, and I turned the bathroom light on. I just walked by, and I came back in. So I was going to take a shower, and I looked in the mirror, and I was covered in blood. A lot of blood. From the top of my head, all the way down my chest, all over me. I had fallen, hit the curb, and I cracked my skull and all my face, right down the line through my nose, into my top of my jaw. If I sneezed or moved too hard, I could feel my face move. And I looked at myself, and I had a moment of clarity, and I said, what are you doing? You're doing this a lot. This doesn't work. It's not working. And I kind of had a breakdown there. And instead of, calling and begging for help or whatever, I went and got the bottle and I poured a drink. And I went and got the bag and I made a line. And I said, here's to another day I'll live. And I continued that way for another year. I got out of that situation and got a 4th DUI. My drinking never got any better. I had moments of sobriety after these DUIs, but it was never a true sobriety because every time I knew I was going to end up drinking. I was just like, okay, I'll just be sober, I'll please my mom and dad, it'll be fine, I'll get through the court, it'll look good. But I always knew I was going to drink. And I always did that, well, I'll have 1 or 2, I'll get this under control, this will be it, this is it, I got this under control. 1 or 2 is fine, all right. 1 or 2, and then we'll try 3 or 4 more, All of a sudden, I'm right back to where I was blackout drunk again. And I was back to almost every day of drinking. when the pandemic hit, I probably was depressed my entire life too, but when that hit, it really got bad. I worked, I was considered essential, so I worked every day, but I had nothing else to do. The liquor store was still open, thank God, at that time. That's what my thought was. I would buy 3 bottles for a week, and it would last me a couple weeks. And then all of a sudden, the 2 bottles would only last, man, not even 5 days. And soon it was going to be a bottle every 2 days. And as soon I was sitting out in the garage for 5 hours at a time, watching YouTube and drinking. I'd be like, all right, I'm gonna drink till midnight, and then I'm gonna go to bed. Oh, it's 2 o'clock. Well, bar time's 2:30. I'll sit there and have another drink. There's a piece of the glass of ice left in my glass. I better make another drink. It's 3:30. Well, I gotta get up for work at 5, so I might as well have a drink and then get ready for work. I go home from work. Maybe I didn't drink that night, but I guarantee you I made that drink. I wake up the next day, it'd be in the refrigerator. I come home, I drink that one, make another one the next day. I'd sit down to have that drink and I might fall asleep, but I wake up, that thing is still in my hand, not a drop out of it. Every night I had to have that drink. I didn't have anybody to drink with except my brother's dog. That dog didn't really start to like me after a while. He's like, let me go inside. I'm like, no, you're gonna sit here and talk to me. The dog, we're good friends now, we're on better terms. He'd be like, dude, it's 3:30 in the morning, I'm tired. And I'm just like, no. But it was every night. And I still didn't have a problem. There's nothing else to do. Then one night, I don't know what it was. I don't know. It was about a year, it was October 17th of my last day, so it was October 16th, 15th, the 14th to the 15th that night. That day I woke up the 14th, I started drinking right away. It's probably 7:15 I made my first drink. By that time, I was still using cocaine on occasion, but in my life I've also used meth and heroin. I've never shot it, I've always snorted it, or smoked it. But that day I had both, all 3 of them. And I used all 3 of them. I mixed them all together. They call it speedballs and goofballs. It's not a good combination of any of them, even by themselves, but to mix 2 of them together is a horrible thing to do. To mix all 3 it really messes your body up, and it really messes your mind up. And then you add alcohol to that mix, you're a slobbering mess. I did that for 8 hours, and then I decided to go downtown to the bar. And I remember I got in the bar, I was doing shots, I was drinking, and I woke up, and my car was over on the curb, stuck, went over a mailbox, and I was so out of it. All I knew was, I knew the car wasn't running, I knew I wasn't home, I knew I was in my car, and I knew I was stuck, and I knew I was fucked. Soon after that, the cops were there. I had just gotten my 5th DUI. I got lucky on my 4th, I got grandfathered in, it wasn't a felony. This one's a felony charge. This one's automatic prison time. This again, it's the 3rd or 4th time in my life I had to have a lot of people come help me out of my car. They called about every cop they had in Reesburg to come help me out of my car. I wasn't willing to come in out of that car. They tased me twice and threw me to the ground, and I woke up in the hospital again, refused service, and then I woke up in the county jail. I watched the video of those cops, my lawyer showed me it one day, and I had to turn it off because I was disgusted with myself. Absolutely disgusted of what that human being was. That wasn't even a human being. It wasn't. That wasn't me. It was never who I thought I'd be in a million years. I can't describe it. It was just who that person or whatever that thing wasn't me. I did not like it. So anyways, I get out, I call my parents, they come, I sit my time, get my bond out, and I'm just depressed, you know. I know it's coming. Something horrible, I know. And then, you know, my mom's like, I told you time and time again, time and time, and it's like, I've heard this for 20 some odd years. What's it gonna change now? You know? My ears still work, I hear everything, my mind registers it, but why? Why could I never get it? Why can't I stop? Why do I have to have that drink? Why do drugs make me feel better? Why do I need that? I've asked myself this for decades and I still can never get the answer. You know, staring at a mirror watching blood run down your nose because you got so much cocaine in your system. You can't sit up straight, you can't sleep. You got bile coming out of your throat because you drank so much. And your throat's so raw because you put so much crap down it. You know, and you think you take these prescription pills like it's gonna help you, but it just messes you up even more. Why? I could never get the answer. I always knew the answer. This shit's gonna kill you, man. It's not good for you, but yet I always had to have more of it. Like Derek said, one drink was never enough. I got to a point where I had one beer, I got physically sick if I couldn't have that second drink. I would just go to bed. Family events, didn't want nothing to do with them then because I knew I couldn't drink. You know, if I could only have one or two beers, I was pissed. I got angry because that wasn't enough. And honestly, there was never enough until I couldn't physically stand up. So a few days after I got out of jail this last time, my mom had to go back to, they were up in Stevens Point, and I was just mopey. And then one day I woke up and I had a decision that I had to make. Because that night before I couldn't sleep, and I said, what are you doing? You're on rinse and repeat. This seems like a pattern you got here, guy. Every few years you're getting another DUI, every few years you're going back to jail, every few years you're getting a little more fucked up. What's going on? And I made the decision in my head that I was tired. I was very, very tired of it. So, I was like, the thought I had was a horrible thought, and I was like, I dismissed it, but the next day I thought about it, and I was like, I like this. This is a good idea. The feeling I had in my body about it was the most concrete thing ever. It was the most certain I've ever been in my entire life. This is what I was gonna do. I knew in my heart, I knew in my head, I was gonna do this. And like Derek said, I wrote the letter. I packed a bag full of bricks and rocks. I changed the barrel of the shotgun, and I loaded the shell. That day, my dad was driving me around, and he was gonna leave that afternoon. So as soon as he was left, I was gonna wait till it got dark, and I was gonna walk down to Plinky's Pond in Reesburg. I was gonna sit at the edge of the dock over the rail, and I was gonna put that barrel in my mouth, and I was gonna fucking hopefully sink to the bottom. So we're driving around, and I'm most certain, I'm actually pretty chipper. I'm feeling pretty good today. And I was like, he's like, well, you gotta do this and this. I was like, oh yeah, I gotta do an AODA, I gotta do the intake and all this. I knew that. But, you know, to appease him, I called. And I got the option of a week and a half, or I could get in there the next day. Well, I wasn't gonna need the next day, so I said, we'll do a week and a half, that way I can cancel and not get charged. This is the great alcoholic addict thinking. They can't charge me if I'm dead, and they tell me within a week. And he's like sitting there, and he's like, yep. And then he said one sentence. This one sentence still blows my mind, and I don't know what it was. He goes, this will look great for the court. That's all he said. This will look great for the court, and it fucking finally hit me straight in the head. Like Derek said, my higher power came right to me that day. He said, this will look great for the court, and I finally realized how to get sober. I finally realized what I had to do to not use or not want to use anymore. I had to want to fucking stop. Not to do it for my parents, my brothers and sisters, not to do it for the court, for anybody else. I had to want to stop drinking and using. 25 years of doing all this, and in the sentence, it finally hit me right in the head, and it made all the sense in the world. I've done it for my mom and dad. I've done it for my sister and brother. Done it for the courts, and yet I always went back to doing it. So do it for you. If you're sick and tired of being sick and tired, then do it. That day I went home, I burned that letter, I unpacked everything. I said, I'll never feel that way ever again as long as I live. I called that place back immediately. As soon as he said those words and I got hit like that, I called him right back. I said, get me in there the next day. Not next week. I said tomorrow, 9 a.m. I'll be there by 8. We don't open till 8:30. I'll be there fucking 7:30. Then I'll wait. From that day on, I walked in there. She's like, it works if you're honest. I said, then ask me anything you want to know. I'll tell you everything. And I told her, I think you might have got Barb. I got one of the girls. I got one of the girls, and all I could see was her jaw get a little lower and lower and lower as I went through my life's history. And she goes, do you have a problem? I said, I just figured it out. I do. I do, and I want help. I said, I've been here so many times before. And I sat in here, I said, I've been in front of you guys before 4 different times, 5 different times, and I just lied my way through it. And then I sitting there, I was like, how many times have people lie? She goes, we know, right? I go, exactly, this is what you guys do, and you're sitting here lying? And she's like, fuck. I've never been more honest my entire life. I got in that group, I met Derek in that group. I met people I'll be friends with my entire life. It took a few weeks to get going in that group, I'll tell you that. It's different. When I had to write a letter, a goodbye letter to alcohol and drugs, then I had to write like a first step where I just poured it all out. And it took me a while. I was like, what do you write? I don't know. What the fuck? I don't know. And I had like the next day to get it done. And I just sat down, I just started writing. And it just started coming out page after page after page. And I read it. And I said, well, there you go. That's Nathan Allen Steve right there, man. Nice to meet you. Met Derek and those guys in that group. Derek got me into an AA meeting in the Dells. I've been to one before. I used them as an excuse. I'd shake the door, pretend it's locked. I'd walk around, pretend I'm lost, can't get in there. Been to a few. I was like, they don't like me. I don't want to go to these things. Just to make up excuses. My best one was like shake both the doors. They both open, but it was like, it's locked. Can't go in. I'm a minute late. I can't go in. And then the big thing is they'll say, the only meeting you're ever late for is your first one. And it's like, can't say this, Say there's like, my sponsor's like, so you shook the doors, huh? I look like an idiot too, and I was like, yeah. But I walked in there and I was like, those doors flew open for that day I went to that meeting. I sat down and those people, they smiled at me, they welcomed me, they hugged me, they said hi, they asked me how I'm doing. They didn't ask me why I was there because they already knew why I was there. They didn't judge me. They didn't be like, oh my God, you did that. Oh my God, I've done this, It wasn't like a one-up. It was I was like, well, maybe they'll try to one-up me. It was just and I've been going to that one ever since. I mean, the 12 and 12 have been phenomenal. My sponsor's really hounding me on my step 4. It's not like I don't want to do it. I'll do it. Just got something coming up that's going to give me plenty of time to do it. We started me and an older gentleman started a recovery meeting in Reesburg at Marty's Steakhouse, called the Breakfast Club. He went back to drinking and recently just passed, not too long ago. But we started it, and a few weeks we had maybe 4 or 5, just some IOP people, and all of a sudden we're up to 20 plus people a week. Every Saturday there's at least 20 people in that room. And I'm not gonna lie, the feeling you get when you walk into those rooms and sit down with all those people is just, it's amazing. They've all done what I've done or all been in some similar situation, and it's just, to know that you're not being judged, you're being loved. They don't, I don't know, it's hard to explain, it's just amazing. They'll listen to you. It might be the most I think one guy yesterday, I shouldn't say this, but he was like, all right, it's not about AA, but God, those goddamn chickens, I tell you what. He just started talking about his chickens. He's like, all right, well, you know what? If that's what's bothering you that day, get it out there, They got all the cliches, you're late for your first meeting, But one of the good ones is what really got me to understand the 24 hours a day and the higher power was, a few of them where you get to make the choice. You don't ever I can drink. People say alcoholics can't ever drink again. The hell we can. We can drink. A lot of them have gone out and proved it, and I know I can. You give me a drink, I'll show you how to drink it. But every day I get to wake up and I get to choose if I'm gonna have a drink or not. It's not that I will not, because that was a big fear when I went to these. Oh my God, I'll never drink again. You know, somebody's taking something away from me, and I'll never get that choice again. When I heard those words, that fear went away. It's like, wait, I get to wake up and I get to say, is today the day I want to drink? No. All right. Today I won't drink. What about tomorrow? Well, we'll get there when tomorrow comes. That really helped me cement 24 hours a day. Another one was religion is for people that don't want to go to hell, and spirituality is for people that have already been there. I grown up Lutheran Christian. I went to Sunday school at church all the time. But when I heard that really rang true to me. That really got me closer to my God. You know, it wasn't just, you go to church to learn about God. No, God is all around me. God has always been there. He was there when I was doing lines of cocaine off the back of a bar toilet seat, It was always right there. It's just I was so morally bankrupt and just corrupted that I just wouldn't let it in. When I heard that that was life-changing for me to hear those words. It wasn't, because I was like, I gotta go to church tomorrow. I still like to go to church. I sing now too, and I'm horrible at it. It's a little lower, but I try it, I used to just sit there and twiddle my thumbs, but now I listen, I feel it. You get a little excitement, you can feel a little something in there when you're in there, but it's not, I served, when I was a kid, church was a prison, I hate to say it, in the church, but, you're just getting dragged there. Now it's like, I wanted to go, I wanted to be there, Even when I leave, it's not like God stays there, God is still with me. Because me right here standing, I wouldn't do this for anybody, Jesus. I tell them at the AA meetings, I was like, you guys think I'm sitting here sober on my own grade? No, this is by the grace of God that I have not had a drink today, tomorrow, or yesterday, or any time before. On October 4th is my sentencing date. I'm facing 1 year of prison time. I shouldn't be here. I should be a flipping mess. I should be out of my mind. I should be not knowing what to do left to right, up and down. I should be on a bar stool spinning around. I brought this up last night at the meeting. I was like, why am I here? Why is this guy that for 25 years couldn't put down a drink, couldn't put down a drug? The only time he ever got excited or wanted to go do something was when somebody said, we're going to get a drink, or I got this bag of stuff. All right, I'm up to, let's go, let's do something. Who wouldn't help anybody unless they had beer, Why am I? It's by the grace of God. And by Deb too, oh my God. By Derek, the IOP family, Barb and all those guys, by the people that come to that meeting every Saturday, by the people I go to the meetings I go to in Lavelle, Dells, Baraboo, all over. It's great. Hey, the 12-step program is great. You can go anywhere. We went to vacation. We were way up north of Monaco, and we went to one in a church. Walked in, these guys just said, hey, what's up? Here's some donuts. Here's this. This is where it was. Like they knew us. They knew why we were there, and it was a great meeting. But I remember when I met Deb, I was going to get the Vivitrol shot too, but I had insurance. And we should all know how well insurance works on sometimes. And it's an expensive shot. And I had a very high deductible. And it was going to be $1,400 or something for me to take the shot. And they're like, well, you'll meet your deductible. I go, the problem is they want $1,400 every time I take that shot. I don't have $1,400 every time I take the shot. It's not like they're just going to wait for me to pay them. And I was like, well, maybe, I don't. But then they got me in to meet Deb. And I think I hemmed and hee-hawed, like, somebody else can use it better than I can, and this and that. She's like, no, you're here, you're getting it. And it's a shot, I'll tell you that. Right in your booty cheek. Big old needle, too. Then it gets stuck in there, we gotta do it again. All right! Then you're sitting there for I remember the first couple shots, it was like a whole 2 weeks, I'm just sitting there, there's a ball right there, and you're just like, oh. And it gets sore, and I'm a diesel mechanic, so I'm up and down, laying on my back, rolling around, and it's like, there's a lump. It's gotten easier. It's gotten easier as it's gone on. It dies out in a few days, but it's still there. But it's just like, I remember I was like, well, somebody else can use it better than I can. Somebody else needs it more than that. She goes, you're here. You need this. You're getting it. And then when we started the meeting, she's been nothing but supportive on that. Got us materials. You know, promotes our meeting, promotes everything about. Has done so much, not just for me personally or Derek, but for the whole recovery community. Just to hear what she's done is amazing. You know, if I have a deal, you know, I don't know how long I have, but hopefully I can at least put my candle right next to hers. I'm sure hers is a little bit higher up there. Mine's burning down here. But I'll be like, it's right there. It's right there next to you. Take a little of your wax, drip it on mine, there you go. What they do over there is just absolutely amazing. They have a free clinic, they have volunteers like that. You know, the doctors that come in there, they're generally curious about how you're doing, and they're glad you're doing it, you know. This isn't easy by any means, you know. I couldn't tell you if does the shot work. I think it does. I mean, I haven't had very many cravings or urges that really at all. But to the people that get it, I mean, it could save lives. I mean, opiate addiction is very, very, very terrible. I've never shot it, like I said, but I've snorted it. It doesn't take much to inject something into your arm or anywhere in your body to get hooked on it very quickly. And I've seen the withdrawals, I've seen overdoses in real life, and it's not. I've been in cars that roll people out. I am very ashamed of that. To watch, yeah, it's not pretty. And to see, you know, I thought I was wasting away, but to watch some of these people just not even slowly, very quickly become nothing but husks. And to see what she's doing, and what all those people over there are doing is just amazing. I mean, I don't know, ever since, you know, God willing, I'll be sober for the rest of my life. There's an old man, he's a little old man, he's like 80 some odd years old, we call him Dale. He's been in AA for a long time. And he asked me the other day, he's like sitting there, and he goes, how old are you? And I go, I'm 38. He goes, oh, that's the year, how old you were when you got sober. I go, I'm the next Mr. Dale. I'm gonna be a short little old bald man, fucking knows everything. Everybody thinks he's the cutest little thing ever. And I'm just like, he's kind of cool. But I mean, you know, you meet these people, and it is. I wake up every day, and some days, you know, some days are just easy. I just go about it. Some days I have to sit there and really think about it. Why? How and why am I standing here? I told you I ramble too. Sorry. I mean, I wouldn't say a word when I wouldn't. The only time I would talk to anybody is when I was drinking. They were sitting next to me. The only person I cared about was the person buying me a drink, or me buying them one. That was it. I never had friends. I had acquaintances that I met at the bar. But why, you know? How is it that the most certain I've ever been in my entire life was to end my life in a simple sentence took all that away? I mean, by the very grace of God. That's all I could be. Because, I mean, I've wanted to be sober so many times in my life. But yet a simple sentence and just a feeling, it all clicked. And then I realized what honesty was, and I was like, ooh, I don't know if I like this. That, you know, it did bring up everything I've ever done in my life. It's not pretty, but I will own it. I'm not afraid to own it. I'm not afraid to admit it. Because otherwise I'll never move forward. I'll never walk straight ahead. Towards the end, I was just laying there waiting for everybody to pass me by. They say you get sick and tired of being sick and tired is when you start to sober up. I was past that. Life went on, I did my thing, but when I got there, I was on the ground. I just laid there and let life go around me, hoping that maybe they just trample me over and I just be gone. These things are powerful. Alcohol and drugs, narcotics are very powerful. I'll never lose that sense. I'll always know that if I have a drink, it very well could be my last, or the one that gets me to my last. Same with the drugs. So I have to be ever mindful. I understand where the whole labeling thing comes from, I get it. But I'm not afraid to say I'm an alcoholic. Because I am. With that, I'll pass.